Was your injury or your loved one's death the result of poor post-op monitoring? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a medical malpractice attorney practicing law here in the state of Maryland, and I would like to talk with you today quickly about that question that I just asked you. Was your injury or your loved one's death because, in other words, doctors didn't pay attention to the patient post-op? We all know that during surgery, there's a lot of stress that can happen to the body. A lot of things can happen during surgery. We also know that after surgery, doctors and nurses have to make sure that they pay attention and they monitor the patient. I want to talk with you today about a case study that I was recently reviewing. And in this particular case study, a patient went in to have surgery, have spinal surgery. Now, this patient was overweight, the patient smoked, and the patient suffered from obstructive sleep apnea. The patient needed a CPAP machine. Well, after the surgery, the patient was sent to the neurological wing, and there were specific instructions to make sure that the oxygen levels of the patient were monitored. But get this, no CPAP machine was ordered for the patient. Well, the nurses who were in charge of monitoring the patient did not frequently monitor the patient like they were ordered. And one night, an evening shift nurse came in and saw the patient sleep, what she said was sleep in the bed, and the patient was snoring, but the patient had a very faint pulse. Well, we're going to fast forward into time because this patient had been without oxygen for a considerable amount of time and had suffered brain damage. And when the plaintiff, the person bringing the lawsuit, when their experts took a look at everything, they found that earlier that morning, way early in the morning, was the last time a documented visit on that patient had happened. Now remember, I told you that the evening shift nurse, late evening shift nurse, is the nurse that found the patient. So essentially that patient had went hours losing oxygen. Now, why have I taken the time today to talk with you about this? Because I'm trying to help you understand the process. I'm trying to help you understand why it is very important for doctors and nurses to monitor their patients. I'm trying to help you understand that when doctors and nurses are not monitoring their patients like they're supposed to post-op, there's a strong argument that can be made that the doctors and the nurses needlessly endangered the patient. If you have more questions about this process, if you think your injury was the result of poor monitoring during post-op or your loved one's death was because of this, this is what I invite you to do. If your matter happened in Maryland, it costs you absolutely nothing to take this action. Pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice questions like yours all the time, and I'll be glad to listen to your story. All right, guys, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Guys, take care and enjoy the rest of your day.